recently, Professor Paolo Pozzilli, who is a professor of endocrinology and diabetes at the campus of Biomedico at the University of Rome in Italy, visited Dasman Diabetes Institute as part of the International Scientific Advisory Board. Kuwait TV conducted this exclusive interview with Professor Pozzilli. Let's now watch the interview with the professor. Stay tuned.
The collaboration is now well established between Campus Biomedico University of Rome, Italy, and the Dasman Institute. That thanks to a PhD student, Miss Gadir Alamar, who is working with us in Rome, and together with their support and the support of other people here in Kuwait, we've been able to establish a new score to predict why patients with diabetes develop critical condition and may die because of COVID infection. So what we did, and the originality of this work, is that we did this work both in Kuwait and in Italy in order to validate the results obtained with the Kuwaiti population with an Italian population. And the results were consistent. So this score that has been established and can be actually applied to patients with diabetes that are admitted to hospital because of COVID consists in evaluation of a number of factors, including the gender, the nationality, the body weight, the asthma, all combined condition associated potentially other diseases with diabetes. And what we have found is that the different level of blood glucose and different classes of blood glucose between those slightly elevated to those very elevated can combine with the other parameters that I've mentioned before, identify a score. A score greater than 5 is that these patients have a high risk of dying of COVID. So this can be established before they are dying or before they actually are in critical condition. So before they are admitted to intensive care. And because of that, we can intervene in order to prevent progression towards death. So this work that was done here was repeated in an Italian hospital at the university, confirming the data in the Italian population. So this is indeed the first score identifying patients that progress with diabetes that progress towards death. And I think this is an original piece of work that could help the population worldwide, I guess, if people are going to use the score that we have established. Yes, now we have established an international PhD program at Rome University Campus Biomedico, and we have students from different parts of the world that come to study with us with different curricula in the field of endocrinology, neurology, elderly people, and also oncology. So students come to Rome after they pass an interview that can be done online also, so that could be extremely convenient. And we have Gadir Alamar in Rome with us that will finish the PhD program this year, will become a PhD in endocrinology and medical and scientific basis for other diseases. So she's a large PhD program. So it's just dedicated not only to endocrinology, but with other similar conditions that could help her to develop her program also here at Dasman or in other places in Kuwait when she can come back. So this is something that I really like to promote more. It's been a very successful experience, thanks also to Professor Fadal Mullah and Professor Eba Al-Zawiri from Dasman, and so look forward to have other PhD student from Kuwait coming to Rome. I've been here on the committee for a few years now, and I can say that there's been an incredible advances in research at the Dasman Institute. This has been done through the new management that has been introduced in 2019, and the number of publications that have been released recently by the Dasman, the funding received also from international funding, could definitely say that the Dasman is becoming an important center of research on diabetes, with clinical application also now taking places. So I'm really in favor of support more and more the Dasman with research, with clinical trials, and all those activities related to the disease like diabetes that in Kuwait has a primary impact on population.